Healthcare regulations. Regulations and rules in healthcare are used to clarify definitions, authority, eligibility, benefits, and standards. To be discussed with will be healthcare regulations, how they are put into law, who monitors and who ensures that they are adequate in the general population and nursing community, and who ensures the individual nurse is performing at the best of their ability. So who is in charge? Federal and state legislation develop regulations in healthcare to ensure the safety of the public as well as the healthcare individual themselves. In healthcare, we are surrounded by regulations and standards that we must follow. The Department of Health and Human Services works with multiple agencies such as Centers of Medicare and Medicaid Services, the National Institution of Healthcare, Centers of Disease Control and Prevention, as well as the Food and Drug Administration. Working with these agencies, their role is to protect the health of all Americans and provide essential human services. There are a lot of legalities when putting forth regulations in healthcare. Things need to go through multiple channels before they can be implemented into practice. But who regulates and ensures that these are the best practices to be set forth as laws? The American Nursing Association monitors federal agencies on policies that they are proposed. They are the voice of 3.4 million nurses in America, ensuring that regulations are the best for the public as well as the nurse. So a couple of the federal agencies that I talked about were the CDC, which protects the health and safety of everybody. They implement the development of programs to help the disease prevention and control, environmental health, and as well as health promotion. The CMS, which is the Centers of Medicare and Medicaid Services, are responsible for administering Medicare programs and parts of Medicaid. They also oversee and implement HIPAA as well as the HCPCS medical code set. The NINR supports clinical and basic research for the care of individuals across their lifespan, with the management of patients during their illness and recovery. The FDA ensures that foods are safe and wholesome and sanitary. Human and veterinary drugs, biological products, and Medicare devices are safe and effective. The FDA also ensures that these products are honestly, accurately, and informatively represented to the public. So the American Nursing Association, who are they? As stated in their website, the ANA advances the nursing profession by fostering high standards of nursing practice, promoting the rights of nurses in the workplace, projecting a positive and realistic view of nursing, and also by lobbying with Congress and regulatory agencies on health care issues affecting nurses as well as the public. Their mission statement is clear and to the point of what their goal is to do. Nurses advancing our profession to improve the health of all. The ANA monitors the Federal Registry for new proposals that are put forward. The ANA reviews regulations that are relevant to nurses and submit comments and proposes changes to these laws that are going to be put into place. The ANA not only monitors legislation regulations, they also put regulations into place on their own for the nursing community. The ANA is responsible for nurses in their standards of their everyday job to do changes and develop throughout time. The RNs have to demonstrate competencies through every aspect of their job. They have the responsibility to be responsible as well as accountable for their actions. Regulatory agencies such as the ANA define the standards of competency to protect the public, but regulations don't just stop there. Someone has to continually monitor and ensure ensure that these are put into action effectively. With 3.4 million nurses, the ANA can't watch everyone and make sure all of us are doing our job correctly. So who does? Our employer does. They are responsible and accountable to provide the appropriate work environment as well as monitor their employees that the nursing practice is competent. This can be done with annual evaluations, skill tests, audits, and also renewal of certifications. The model of professional nursing practice regulation, as seen in the image, it's a pyramid. The image posted is the model set forward and defined in the scope of standards practice put on by the ANA. The lowest level represents the responsibility professional and the responsibility the specialty nurse organization to their members and the public. The next level up represents the regulations provided by the Nurse Practice Act and rules and regulation in the pertinent licensure jurisdiction. The third level is the institutional policies and procedures to provide further regulations of the nurse practice for RNs. The top level of the pyramid is self-determination. After consideration of all levels, the nurse practice and regulation, the nurse still needs to have self-determination and ensure that the care that they are giving each patient is safe, the highest quality, and with the use of evidence-based practice. So, I know it's a pretty complex question, but how do you make sure that you follow all the regulations and policies put forward? Before researching this topic, I never realized how much work is put in to ensure that what we do as nurses is done correctly. Every aspect of our job and what we do is gone through research and gone through multiple channels to be put into action. For me, ensuring that I'm up to date on the latest edition of the scope of practice put on by the ANA is extremely important, as well as monitoring the policies that are put into place by my workplace. So, thanks for listening.